like 108, there are available in metros, other services. Can you enlighten upon that?
I'll give you my perspective about telemedicine. Of course, the panel will give their opinions about it. I feel that unless you got right sort of equipment and right type of need clearly identified, the telemedicine just remains. I mean, I attended last telemedicine conference in Pune, and the numbers that were projected for even Pan-African telemedicine project which was, very small numbers. Actual consultation happened during the years. Whereas if I see a properly planned, and not only stressing about IT, how well equipped the van is, what is the dish size, and not, like communication, without stressing too much on technology, if correct need is identified. I'll give you a simple example. In Tata Memorial Hospital very recently, they have done a rural program of detecting and treating early esophageal cancer. See, esophageal cancer is when patient is symptomatic. That means when you feel there is a problem in swallowing, you're already in third stage. So 1 in 10,000 patients, they say, will be cured in the normal course of detection and treatment for esophageal cancer. So they've clearly identified that what could be the areas prone to this. They have created enough awareness program there so that people in the rural area look at it not with just awe and fear. They know what the van does, what telemedicine concept is, and it is backed up with adequate infrastructure for treatment. I'm personally strongly against any diagnostic telemedicine unless you provide treatment also, because it increases unnecessary trauma. The patient was otherwise not aware. You go there and say that things are wrong and don't do anything later. But I definitely accept that certain cases where follow-up trips, for certain chronic like cancer, you need follow-up multiple times, and then it is just a kind of interaction with doctor and consultation, but that is essential to be taking place between the same doctor and same patient. Telemedicine helps a lot. Video conferencing is one of the components of telemedicine, but telemedicine also can interface many other equipment such as patient monitors, other digital equipments, diagnostic equipments to get the full picture of the patient, and the patient is not next to you. See, basically, clinically, in diagnostics process, you have got first history, signs, symptoms, symptomatology, then physical examination, and then diagnostics. For history and symptomatology, you don't require patient history. Somebody can feed that in. Mainly for physical examination and differential diagnosis, you need the interaction. So what telemedicine, as I see, aims at leveraging that physical examination equivalent. It cannot be the same quality as that of a physician examining the patient himself or herself. But it's a substitute where there is no other alternative. And this is, I think, there are many models coming up because it depends on what type of diagnostics you put, what type of specialists you put.
Just 1 minute. I'm Dr. Ramana. I'm a cardiothoracic surgeon working in Care Hospital. Yeah. And I'm very much impressed by this thing because I could hear some familiar words in this thing. One of the problems we face, we operate on a lot of village patients, rural patients. Yeah. Because as a cardiac surgeon, I face the dilemma. One is patient compliance. Most of the times you are busy, somebody discharges them, or 1 month they stop all medicines, they come after 3 months with a stroke or something. That's another very painful aspect. And one more thing is reminding them of the regular checkups and all that. Yeah. And one more is telemedicine. Suppose I do a wall replacement, just doing a prothrombin test time and all that. Yeah. They travel 1,000 kilometers, it's 2 attenders, spend 4,000, 5,000 rupees just to get a blood test done. I see for a minute and send them back. Yeah. These things, what's your solution? What's your idea for avoiding all these things?
Yeah, see, there are two aspects here. One is that why does the patient come to the hospital? Because there is facility available, there is trained technicians or the staff available, and the interpreters in the form of consultants who can interpret the results are available. But the last part can be solved by telemedicine because the results, as long as the results travel and they reach the consultant, they use solve. The first two, there is challenge because what kind of equipment can remain there and reach there in time, can be maintained there locally, and can be used effectively by somebody, because the patient themselves cannot probably do it. Now, as long as we identify ways and means to do this, right? Some of the models they follow that the ECG can be
Transmitted.
that's the easiest thing to do, and the
Yes.
training is like not that difficult.
Yes.
Main challenge is that, saying that how do we ensure that adequate skills are available locally to at least complete the scan. So the other side is that let's not put the equipments there. Let's carry the whole van there along with the necessary skill set. That is the next concept that they are trying to find out if it can be done.
Thank you.
Yeah.
Thank you.